If you have or suspect you may have a health problem, or if you require answers to specific healthcare questions or concerns, you should consult your physician or healthcare provider and not depend solely on information presented in this program.
And hello, I'm Dr. Steve Garner, and welcome to Ask the Doctor. It's great to be with you today. This is our 16th season. As you know, this program was created to assist you in understanding medical issues so you can take charge of your own health. It's more important than ever to become an informed patient, and we're here to bring you timely health discussions. Now, for those who are new to the show, there are two ways to get your questions in. First, by calling our live phone line at 718-499-6101. And second, you can email your questions to askthedoctor@netny.net, and we'll bring them into discussion. And we have a great show tonight. For this episode, we have Dr. Edmund Gigerich. He's the Chief of Endocrinology at the New York Methodist Hospital. Next to him is Dr. Terence Sacchi. He's the Chief of Cardiology at New York Methodist Hospital. And next to him, Dr. Anthony Saylor, a pulmonary attending at New York Methodist Hospital, as well as a member of the Board of Trustees. So this is a pretty distinguished panel we got here tonight. I'm a little bit uneasy with this group here, but we'll see. I'm in the news. We got to get to in the news segment because we have such a busy show. So what's going on in the news? You like that? I don't know if you saw our graphic. Beautiful new graphic there in the news. A bitter pill to swallow. And this is kind of a serious topic. Children in Chatham, New Jersey went to CVS Pharmacy to get their prescription filled, and instead of given fluoride, which helps their teeth stay healthy, they were given tamoxifen, which is a cancer drug. About 50 kids were given this over a 2-month period. Now, luckily, it doesn't look like any of the kids are going to have a problem, but there is the potential for a problem with that. And if it could happen with tamoxifen, which is a cancer drug, could it happen with a oxycontin or bad pain medication or heart pills that could affect the children? So you wonder how this could happen. And tomorrow there's supposed to be a report on it. But you wonder, was this foul play? Was this just a mistake? But how does a mistake occur over 2 months and 50 kids? So it's very scary, and I think people have to be proactive. When you go into the pharmacy, if you're getting a new prescription, I would open up the bottle and show it to the pharmacist and say, is this what I'm getting? What am I getting for? What are the precautions? Talk to the pharmacist. We used to do that with the old-time pharmacists. Now that these big companies are taken over, you really don't have that opportunity. Many people even get their medications through the mail. It's hard to talk to someone. But if you're taking one already and they're switching to a generic brand, look and see or ask before you take, and especially before you give to your children. So hopefully that's going to end happily, but we'll be able to prevent other events that might have been more serious. Next item in the news, kids who are snoring. I don't know, you guys have, are they snoring at all? Any of your kids snoring? It seems that if they snore, they're not as well behaved. They're 60% more likely to have behavioral problems. They get thrown, not thrown out of school, but they have to stay in the back of the room. What did they used to do when did you ever go in the back of the room, Dr. Saylor?
Yeah, I got a lot of wrist slaps too.
They don't do that anymore, but I think it was, what do you think?
I don't think it's done much anymore.
They're not done much. Do you think it was worthwhile?
I think it's a big thing.
Did it help you?
No.
No. Okay. But anyway, so now, I guess the moral of that story is if your kid is snoring, maybe try and improve his sleep and see what you can do. If they're getting bad sleep habits now, it goes over into life. And we have people that do sleep disorder, so something to look for. We had great weather this. We were just talking about the winter. Amazing, right? How warm. Well, naturally, whatever good happens, something bad might follow. Allergies are coming early. Already we're starting to see pollen. And we didn't see pollen counts last year until next month. We've seen them in April, in February already this year. So just if you're allergic, have you seen anybody yet, Dr. Saylor?
Yeah, fair amount.
It's amazing. They're coming in,
Yes.
what are we, in February, March? Incredible. Now, movies. You go to the movies, you want to relax, it's fine. But it seems that if the kids, particularly the teens, watch people drinking in the movies, they're more likely to be a binge drinker. So I don't know what to do about that. How can you monitor that? There's always alcohol in movies. It may not be a part, but maybe you can talk with your kids and tell them about binge drinking and how much of a problem it could be. And finally, in this busy week, strong bones and vitamin D. I know a lot of women who are out there playing different sports, and particularly the young, the teenagers, are prone to fractures, particularly something called stress fractures. And you say, well, vitamin D, what about calcium? It turned out that the higher the calcium level that these people had, the kids, the more likely they were to have a stress fracture. Not sure why, but vitamin D seems to have a protective role. Taking 600 units, international units of vitamin D seem to have a protective role in particularly the young athletes. So it's something to think about, talk to your doctor about. Monsignor Bennett over there and looking in great shape, enjoying the beautiful day today, wasn't it, Monsignor? It was really beautiful. He walked over here tonight. It was very nice. We have interesting quiz, as we're trying to have two quizzes now. One, we're in the Lent season, so we have a Lent quiz and a non-denominational quiz. So the first one is, during Lent, people often give up various foods and other pledges. According to a recent study, this item is the hardest pledge to keep during Lent. So what substance or article is the hardest pledge to give up during Lent? Interesting. You wonder how people decided to do that study. They got out there, they get the money up, and then it's interesting studies. We had a sad week this week for the pop music. Davy Jones, what's your favorite Monkey song, Dr. Sacchi?
Last Train to Clarksville.
I like that. You like Daydream?
I would say Daydream Believer.
Daydream Believer, Dr.
I would agree with Dr. Sacchi.
Yeah. Happy Together was another one of theirs. Great songs. Well, it turns out he was also an actor. I didn't remember this. And he received the Tony nomination on Broadway for what musical? So that's going to be the question. If you can tell me, Davy Jones, the monkey guy, had a Tony nomination, I think it was back in the 60s, late 60s, maybe early 70s, for a musical on Broadway. What was the name of this musical? Okay, get your pencils and papers ready. The number to call is 718-499-6101, with tonight's topics are endocrinology, cardiology, lung disease, internal medicine. Now you can email your questions to us at askthedoctor@netny.net. Don't go far, we'll be right back.
Place your business on TV by becoming a sponsor to one of NET's family-friendly programs. See an increase in your revenue by reaching a potential audience of 4.3 million viewers in the tri-state area. We have a number of packages available and will even produce your commercial. For information, contact us at the number on your screen and get ready to see yourself on NET.
And welcome back to Ask the Doctor, where our topics are endocrinology, cardiology, lung disease, internal medicine. Now, before we meet the doctors, I have to give a shout out to two loyal listeners, Joyce Pashota and Vivian Bubal, whose birthday's today, Vivian Bubal. So happy birthday out there. And we had a correction, incidentally. Happy Together, so Happy Together, we think is not the monkeys. Dr. Sacchi?
Turtles.
The turtles. I don't know. I get those two. I always get the monkeys and turtles mixed up. I don't know what But anyway, Daydream Believer is probably their best song. Dr. Gigerich, it's great to see you tonight.
It's great to be here.
Now, you have a Brooklyn roots there, right?
Sort of.
Sort of.
Well, it starts with medical school in Brooklyn, and then after I did all my training, I came back, and I've been practicing in Brooklyn for my entire professional career.
But also Queens link, too.
Yes, I live in Queens.
And you were born in Queens?
No, born on Long Island, but my wife was born in Queens, and that's where we settled.
Very nice. And it's great, your second appearance, I think, on the show. It's great to have you back by popular demand.
Well,
You're
thank
a big hit in the last. We talk about diabetes, thyroid disease, anything that endocrinology, either from the most expert area to the most general area. So it's great to have you.
Thank you.
Any trips coming up?
Yeah, a vacation towards the end of the month to Florida, and we're going to try to catch Yankees down there.
Never went down there. Did you ever go down there, Anthony?
I saw a few exhibition games.
One of the big Yankee fans. You're a big Yankee fan, too?
Yes.
So we've got, okay, so this is a Yankee. If you're Met fans, you want to
Turn off the screen.
Turn it off.
Anyway.
Turn your sets off now.
Dr. Sacchi, who's been with us numerous times now, and they come as a team. Dr. Sacchi and Saylor come together. What's new in the cath lab over there? What's going on?
Well, I think the treatment of heart attacks and myocardial infarction I think continues to grow. Our program at New York Methodist provides 24-hour, 7-day-a-week service for anyone who has the misfortune to suffer a heart attack. And the instruction is to get to the hospital as quickly as possible. The EMS is very, very efficient in getting patients. Even if they're not sure, I think it's very, very important to get to the hospital quickly, and we can actually deal and open a blocked artery very, very quickly. with tremendous results. And we're very proud of what we've accomplished. And
How do you get the cardiologist to stay up all night? That's what I want to know. How do they
it's
do
part
that?
of, and it's in the genes. I think.
It's amazing because to stay up night and to be ready to go on a moment's notice with such a delicate area, it's great.
It's we try to get it done. We have to get it done within 90 minutes of the call. So
Of the call.
Of
So
the
wait,
call.
if I'm having chest pain at home, is it start from when I leave home or when I get to the hospital?
Your prognosis is predicated from when it begins, but our time is when the ambulance calls it in. So the ambulance people will call it in as they're getting to the hospital, and that's when it starts.
Okay, very good. So we had a lot of anything to do with heart and irregular rhythms and valves. Dr. Saki's here, and Dr. Saylor, who's I was just thinking, is a basketball player back in college, point guard,
Shooting guard.
shooting guard, and big Yankee fan, as we know. Runner, great runner. Board of Trustees.
Below average runner.
You're probably the fastest on the Board of Trustees. It's a good
It's not saying no.
saying much, not including wheelchairs. And so, what's going on since we saw you last? Anything?
Well, we in Methodist we will be opening up a lung cancer screening program within the next month or so, and that should be very exciting for the people who smoke and who are at high risk of lung cancer. There's been a lot of studies, as you well know, that have validated now screening for lung cancer. So that's something we're very excited about and hope to get off the ground in the near future.
So, should people be calling now, or what should they do?
No, we're still in the process of setting up the program. Hopefully, within a month or two, we'll be able to have a number to call, and I think it'll be a very popular program.
We'll put that on our website. So keep checking our website, and we'll have because this is really it's going to save it's going to save lives.
It could save lives, absolutely.
Amazing, very good. As a friend, also on top of that, and thank you, and it's great to have you.
Good to be back.
Now, as a fantasy baseball player, who should I pick number one in the draft? Do you have one?
Mariano Rivera.
Really, at this age too?
Yes.
Okay. All right, good. So now that we got everything out of the way, we have a big, busy line. Let's see who's going to be our first caller of the night. Could it be Grace? Could it be Maddie? Could it be Patrick? Hello?
Yes.
Who is this, please?
It's Grace.
It's Grace. How are you, Grace? Good to hear from you.
Yeah.
You don't sound too happy tonight.
I'm pretty good. No, I'm pretty good. I'm just concerned about that thumb of mine. I spoke to my doctor, and he a month ago he diagnosed that I have like a fungus on my thumbnail. It's like a hard crust. It looks like a nail growing over another nail, but it got much bigger. He wanted to give me a salve or pills, but he was afraid it would affect my liver. So he says, leave it alone for a while and see how we get along. But it got much bigger.
Grace?
Yeah.
Let me ask Dr. Saylor to weigh in on this one.
I think
Dr. Gingrich, you can weigh in?
Wait a minute, I wanted to explain something.
No, let's get it. I think we got a picture. We got the picture. You got a fungus under the thumb.
What your doctor offered were the appropriate treatments, and usually to cure this, you have to really take medication by mouth, pills.
Grace,
Yeah,
I hope
know,
that
but
helps.
he
You're
says
doing the
that
right
it might
thing.
affect my liver, so I'm scared. I have an appointment Monday with Kings County Dermatology for 1 o'clock in the afternoon.
Okay, and I think you'll find out that they think that the risk versus the benefit, that the benefits outweigh the risks in this
I mean,
case.
I wouldn't have to lose my nail. You think one of my girlfriends told me you might lose your nail. They might have to remove it. Is that possible?
You know what? You're going to see the dermatologist. Let's leave it at that, okay?
Yeah,
Do you have an answer to our quiz, Grace?
Well, I was. Wait a minute. Give me the quiz because I was out of the room. I was drinking something.
Grace, okay. All right.
Repeat it.
What's for Lent? What's the number one item, the most difficult item to keep, the most difficult pledge to keep during Lent?
Well, eating food, some kind of food, like meat or something.
Okay, meat is a good one. Let me check with our judges. Judges, is it meat? Grace, I'm so sorry. You're very close, very close.
Well, what was the other one? I didn't. There was 2 quizzes.
Do you remember the other one?
yes, David.
Dave. Yeah, I don't know if the Monkees. You ever hear of that group, the music group, the Monkees?
So many years ago. Yeah, I guess so.
Well, the lead singer died.
What's that?
The lead singer, Davy Jones, died. He won. He was a nominated Tony actor. What musical was he in that he was nominated for the Tony?
What, musical?
Yes.
Good
Good question, right, Grace? Grace, I got to move on, but it's always
Yeah.
good to hear from you.
All right. Wish me well and good luck to you all. Thank you very much for helping me out. So I'll go Monday and leave it up to the doctors.
Give us the follow-up, Grace.
Absolutely.
Thanks a lot. Okay, it's a tough one, those fingernails, right?
Absolutely.
If you come in with a fingernail missing, do they give you a break on manicure, or they don't do that? There's always a bright side. Patrick, how are you?
Hey, Dr. Garner, how are you?
Good to hear. What do you think of our panel tonight?
Oh, it's a great panel. You always have a great panel.
Thanks, yeah. Are you a Yankee fan, too?
Yes, very much.
Yeah, we got big Yankee fans here. So what's going on?
Not much, Dr. Garner. Remember last week we were talking about the pancreas?
Yes.
And I had called the doctor. I didn't go in, and he told me that the oil in my stool was probably because I don't have my gallbladder. Is that possible?
Yeah, he had some oily stools and some abdominal, some belly pain, and he wants to know if that could be from his gallbladder.
More likely that you may have a little bit of a problem with your pancreas. I think you need to follow through with your doctor who'll do the proper evaluation.
Who are you going to see, Patrick? I think Patrick, I'm going to have to move on because I think you're listening to the TV.
No, I'm not. Hello?
I hear like a feedback, Patrick.
No, hold on. I'll get rid of it.
Okay.
Yes, Dr. Garner. Yes.
So, Patrick,
okay,
did they say your pancreas was not working well?
Well, they didn't say nothing about my pancreas. I just spoke to him over the phone, and he said that, every time I eat bad, it seems like that happens to me.
Could be the gallbladder, like he said, and there are some simple tests to do.
Right.
And
Gastroenterologist. See a gastroenterologist.
Okay, great. Can I take a shot at that quiz?
Okay, which one you want to answer first?
I'm going to go with, I either have two choices, cake or cigarettes. I'm going to go with cake. Cook cake.
Okay. Judges, is the number one difficult item to keep during Lent giving up cake? Oh.
Wow.
What do you think, Patrick? This is a tough one. This is a tough one. It's not easy. Nobody said here it was going to be easy, but that's why this plaque is so valuable. So what is the other question? You have the answer to the Davy Jones question?
No, I go Guys and Dolls. I don't know.
Guys and Dolls. Judges, is Davy Jones nominated for Tony for Guys and Dolls? That was a great movie. That was a great musical, Guys and Dolls.
Really.
Patrick, have a great week.
I want to say hello to Big Vinny over on the 6th Avenue. He's not feeling well.
Oh, I'm sorry. So feel better, Big Vinny, okay?
Thanks, Doc.
Take care.
Bye, Patrick.
Hey, Jane, how you doing?
All right, how are you?
Okay, speak up a little bit so we can hear you.
Can you hear me now?
Better. So where are you calling us from?
Queens.
Queens. Well, I got the Queens man next to me to the left. What about London Lenny's?
Right.
You like?
Yeah.
I know you like that, Jane. What do you think?
Never
Yeah.
been there.
Never been to
Been
London?
past it, but never been there.
Yeah, many people have done
Yes.
that. Maybe a good move.
Right.
But anyway, it's an interesting restaurant. The fish is fresh, but not the day you get it. So what can we do for you? Jane?
Yeah.
What can
Question
we-
is for the endocrinologist.
The endocrinologist is right here.
Right.
I'm ready.
Okay. The problem is I'm diagnosed as a diabetic since 2004. And the problem is that when my sodium goes low, like one time it went to 109, but when it goes under the range, my A1C comes perfect.
Well, that's the point. You really want to have sugars as close to normal as possible. That the sugar you just mentioned is a very normal blood sugar, and you want your A1C to be normal. And so it sounds like you're doing well. Are you having sugars lower than 100?
When I wake up in the morning, my sugar is anywhere 70 to 90.
Well, that also can be a normal blood sugar. We don't know what medicines you're taking, but maybe you need to speak with your physician to adjust them.
What's a normal hemoglobin A1C?
A normal hemoglobin A1C is less than 6.5.
Less than 6, so people out there should know that number.
Right, but
It only happens when my sodium is low.
Her sodium is low, it only happens.
Right.
I don't understand why that would be.
Me either.
Okay.
Where is your office in Queens?
No, my office is in Brooklyn.
Oh, Brooklyn.
Brooklyn.
Oh, okay.
You got the number there if you want to follow up. Maybe when she's dehydrated, do a little bit. I don't know. Dr. Gigerich needs to think about
I'm
that
perplexed.
one. He's going to think about it. If we come up with something, keep watching the show. We'll give you an answer.
And I want to tell you an answer to the quiz.
Oh, sure. Which one you want to do?
Both of them.
Okay, let's start off.
Okay, the first one I believe is what was the question again? I forgot. Oh my
I
God.
know this one. Giving up something for Lent is a tradition at this time of year. Which is the hardest thing that you give up to keep? You know, you say, okay, I'm going to give up whipped cream, and then the next day you're having it. Which is the hardest?
Chocolate.
Chocolate. Is the hardest item chocolate? Oh my God. Was that dark chocolate or light milk chocolate?
Dark.
No, still not right. But it was a good try. Now the other one is Davy Jones of the Monkees was nominated for a Tony for which musical?
Hair.
Was that the one with the risque thing? Wasn't that with lack of
say
clothing?
Hair.
Yeah. Is it Hair? Remember what a stir that caused on Broadway? Hair? There was like one scene.
Yeah.
Did they? I don't remember. I was too young. But
And do you know I didn't get my plaque in January?
Oh.
from January,
Yeah, January 30th.
somebody's going to pay for that. But what we're going to do is I'm going to have your name taken now, and we're going to make sure. I'm really sorry about that.
No problem.
Okay?
Okay.
Be
care.
well. Take care.
Bye.
We have Larry. I think this may be Larry from Rockland County, one of the furthest away. Is this Larry from Rockland County?
Yes, Dr. Garner.
Oh, it's good
How
to
are
hear
you?
from you.
I've had somewhat of a cold, and I was calling because I wanted to speak to Dr. Gigerich and
He's busy tonight.
check on why my glucose levels have gone out of sight, even though I've increased my insulin intake. I had a cold or the flu, whatever you want to call it, and the residue of the cold has left me with a running nose and a cough. I still have a productive cough, but I have no fever. I haven't had fever for a week, but I eat my normal breakfast or my normal lunch, and I end up with blood sugars of like 300 and 400, and I've increased my insulin intake by 50%. And I was wondering if the residue of the cold is causing the metabolism to function like this.
That could very well be, and that can go on for a while. So, are you speaking with your physician?
No, I haven't contacted my physician.
I would advise that you go in and be seen, and maybe Dr. Saylor will weigh in. If you're still coughing, you may want to go in, get examined. He may want to look to make sure that you don't have a pneumonia that hasn't cleared.
Dr. Saylor, what do you think?
Even though the fever has is no longer elevated.
Larry, I think that although you may not have pneumonia, a lot of times when you have the flu, after you get the flu, you get what we call this bronchial hyperreactivity, where your bronchial tubes get a little inflamed. It sounds like you might have that, but still it would be very reasonable to see your physician. Perhaps a chest x-ray would be in order, particularly with your blood sugars remaining high.
Okay.
Interesting.
Okay, I appreciate
Feel
those
better.
comments.
Thanks.
Thank you.
Drink a lot of fluids, too.
Yes, I tried to drink a lot of fluid.
Feel better.
Okay, thank you very much, doctor.
Thank you. Now, I had two emails. I wanted to do one email. It was a cardiology email, and the other one was an email. I can start with Dr. Saylor, or we get the cardiology one run up. Dr. Saylor, whooping cough seems to be making, I hear in San Francisco there's an epidemic. What's going on?
Right. So whooping cough is caused by an unusual organism called pertussis, and it's a fairly difficult diagnosis to make. In children, it's a little easier to make. They have sort of a characteristic barking type of cough. In adults, it's a little trickier to make, but still, we have seen cases of whooping cough. It's when someone has a cough and it's not getting better and it keeps on perplexing the patients, and the physicians doesn't really know what it is. The chest x-ray is normal. That's the time that you should at least start thinking about it. And you're quite right. There have been some cases reported. We see maybe a couple a year, right? But if you don't think of it as you rightly described, then you won't make that diagnosis.
Whooping cough. Interesting. I thought you get the shot, you're protected, but I guess not.
Not always. No.
Interesting. Thanks. The emailed question actually is from Eileen in Brooklyn. She wants to know, she was diagnosed with atrial fibrillation in 2011. She had a rapid irregular heartbeat. She's been hospitalized 3 times for the condition and had 2 cardioversions. And that lasted about 2 weeks. She was put on some beta blockers and cardizem, which lasted about 2 months. She was hospitalized in December and got a medication called amiodarone, and is now on she's on that now and a beta blocker. She has had no episodes since then, and she's researched amiodarone, and the side effects seem more scary to her than atrial fibrillation. Should she think twice about taking it?
Well, it's a great common question that comes up, Dr. Garner, and there are several issues, and it's a multifaceted approach. The key is that the data would suggest that you don't need to convert the patient back to a regular rhythm. And it seems that with the cardioversions having failed very quickly, I wouldn't do a cardioversion again. And then I would just focus on controlling the rate. If she's in sinus rhythm with this medication, it would be reasonable to continue. The side effects of amiodarone are significant. However, with the dose that she's on, which is different than the earlier days, those side effects might be less. But if, in fact, she went back into atrial fibrillation and is still on Pradaxa, then I would just stop the amiodarone and maintain her something just to control the rate.
How dangerous, I have to be in atrial fibrillation all the time, right? How dangerous is that?
You can live with atrial fibrillation forever. However, there is a significant risk of a stroke, an embolic stroke, of clot breaking off from the heart if a patient has been in it for a long time. That's the reason for the anticoagulation.
I see. Thank you very much.
You're welcome.
We'll go to Donna and then take a break, but let's get Donna on the line first. Donna, hi, you've been waiting around a while.
Hi, how are you, Dr. Garner?
How are things going? Where are you calling us from?
Calling from Brooklyn.
Which part?
Between Dyker Heights and Bay Ridge.
That's nice. Beautiful lights out there during Christmas, huh?
They're the best.
Do you put out a display?
Oh, yeah, we do, but they're not as good as the ones on 12th Avenue.
Yeah, well, it's the heart. It's the heart more than the display, right?
Yeah, absolutely.
That's what I keep trying to tell my wife when I give her a gift. You know, it's a little piece of jewelry, but it's the heart. Right?
Yeah, that's true.
So what can we do for you tonight?
Well, I really don't have a question. I think I have an answer to one of your teasers there.
Okay, and which one is it going to be so I can...
The Davy Jones.
Okay, Davy Jones, the lead singer of the Monkees?
Yes.
He was nominated for a Tony Award in what Broadway musical? Was it back in the 60s or 70s?
I think it was Oliver.
Was Davy Jones nominated for the play Oliver, the musical? Wow.
Hey.
Wow.
Nice.
Donna, did you see Oliver?
No, but I was a big Monkees fan.
Tell me a couple of their songs that we didn't mention.
Last Trains to Clarksville.
That was Dr. Gigrich's favorite,
That
yeah?
was Dr. Saki.
That was another one.
Thank you.
And when Daydream Believer,
Daydream Believer was the best.
that was the best song, right?
Absolutely.
Yeah, WABC, right? Cousin Brucey.
Yeah, and they had a lot of tributes to him the last week or so. They played all his songs, which
Too
was...
bad, 62. By the way, I got Dr. Saki. He drops dead at 62 of a heart attack. Think
Yeah.
he had warnings, or?
You know, the data would suggest that most patients have warning, but they just don't appreciate it. They think it's something else, and it's truly unusual where patients don't have symptoms, but many times they're mistaken.
And sad. So that's great, Donna. We're really happy for you.
Thank
We're going
you.
to speed that plaque out to you, okay? And, you know, they start engraving right away. So you're going to give your name, and we're going to get it on the plaque.
Thank you, Dr. Garner.
Have a great week.
You too.
Take care.
Bye-bye.
Well, I always like to hear a satisfied customer there. That was a good one. Oliver. You knew it. I saw Dr. Saylor shaking his head.
I wasn't certain, but I thought it might be Oliver.
Oliver, yeah. Interesting. So what we got to do now is take a short break to recoup some of our energy here.
Okay.
We've been put to work here, a lot of people. Now, don't forget the topics. They're endocrinology, the cardiology, lung disease, internal medicine. So don't go far. We'll be right back.
Place your business on TV by becoming a sponsor to one of NET's family-friendly programs. See an increase in your revenue by reaching a potential audience of 4.3 million viewers in the tri-state area. We have a number of packages available and will even produce your commercial. For information, contact us at the number on your screen and get ready to see yourself on net.
Welcome back to Ask the Doctor, where our topics are endocrinology, cardiology, lung disease, and internal medicine, where we have Dr. Edmund Gigerich, Dr. Terence Sacchi, and Dr. Anthony Saylor. Now we're going to go to the questions. Dr. Gigerich, I always like to hear your daughter's watching or not?
I hope so.
Let's give her a shout out.
Hi, Leslie.
Good to see you, Leslie. It shows ratings of at least one, so I always like to see that. Okay, we're going to go to Vinny on line 4, who claims that he has the answer to the quiz. Hi, Vinny.
Hi, how you doing?
Good, man. Where are you calling from?
Brooklyn. This is Vinny from 6th Avenue, Patrick's friend. He's always mentioned me on...
Oh, Big, you weren't feeling well tonight.
I'm sorry.
I heard that you were under the weather.
Yeah, I'm okay, but I'm all right. My question was for Patty. He's calling me up. He doesn't have a gallbladder anymore.
He does not have it?
No, it was taken out. So the doctor, he didn't give, he didn't ask... He didn't tell him that.
Let me straighten Dr. Gigerich out. Were you answering that, Dr. Gigerich?
I was trying.
Okay, he's reading the old script. He's got no gallbladder.
Okay.
So I know they're still going to say see the gastroenterologist.
It's exactly the right answer.
But there are when the pancreas malfunctions, it can definitely cause problems with the stools and fat in the stools. Anybody else want to jump?
It's a little dangerous.
Bile and everything. I understand.
Yeah, and of course it's a subject to drinking definitely is not a good idea. Not
any of that.
Yeah, and there's certain medications are not good with pancreatitis and so on, and stones in the gallbladder. So he may have had a stone in the gallbladder, and it's not that far fetched that it could be related to his distant gallbladder.
Well, like I said, he had it removed. The gallbladder.
I wonder, did he keep it in the jar? I think they give you that in the jar.
Yeah, he's going to put it with the plaque.
With the plaque. So, Vinny, I heard you had the answer to the quiz.
No, I don't, Doc.
Oh. So when we call you, we should...
I thought it was smoking.
Oh.
That was a good one.
I think that's a good one. Is that an official guess?
It was either smoking or drinking. I'm going to go with the smoking.
Okay, Big Vinny says smoking. Is it smoking? I think it's a good guess.
Good guess.
All right. Listen, I have a question for the cardiologist, Doc.
Sure, go ahead.
Okay. My question is stents. Do they have, after people have been stented, is there a possibility of having giving them high blood pressure?
The stent itself should not affect high blood pressure. There's been no data supporting that. That's never been seen. The high blood pressure would be a separate problem and usually treated with diet and medication. But to answer your question directly, stents per se have no effect on blood pressure.
Okay.
Okay, Vinny, have a great week.
Okay, Doc.
Call us again. We'll go to Caroline. Hi, Caroline.
Hi, how you doing?
How are you doing? I want to enunciate a little bit louder.
Okay, no problem. This is actually Shakaya. I'm Caroline's daughter.
Oh, Shakaya. Beautiful name, Shakaya.
Thank you.
Excellent. Where are you calling us from?
I'm calling from Brooklyn, New York.
Which part? So we get an idea.
Clinton Hill.
Clinton Hill. Nice
Yes.
neighborhood. So what landmark is near Clinton Hill?
You have what's that park? By the Brooklyn Hospital.
What is it?
Yeah, you have the Clinton Hills Park. Fort Greene Park.
Oh, Fort Greene, near the Berkman Academy of Music, maybe?
Yes.
Very nice. That's a great building, by the way. Any other city, if that were in any other place, it would be like the major attraction of that city. Excellent. So what can we do for you?
Right, okay. I just had a baby 3 weeks ago.
Oh, congratulations.
Thank you. And during the pregnancy, I suffered from preeclampsia.
Okay.
And I had a lot of bad migraines. However, I was told that after I had the baby, the migraines would be gone.
Okay.
Now they're back. And I'm having them every day, and they're strong, like shoots right across the forehead.
All right, let's see, Jacqueline. Let Dr. Sacchi, I can see the mind is working right there. Let's see what he has to say.
I think you were giving good advice in that the headaches usually do desist once the preeclampsia and you've delivered and everything is okay.
Right.
My first glance would be to just give it a little bit more time because it may resolve. Is your blood pressure in control? That would be the question I would have. And if it is, then I would just wait a little while longer. If you've never had migraines before, I just think it probably would be prudent to wait just a little bit longer.
Right.
What is it, a boy or a girl?
It's a girl.
What's the name?
Her name is Kenzie.
Kenzie, very nice. Who is it named after?
Thank you. No one special. Her grandfather, my dad, gave her that name.
Beautiful name. Great
Thank
name.
you.
If you don't get better in a couple of weeks, give us a call back.
Sounds good. Thank you so much, guys.
Take care. Bye. We're going to get to Ravi in a second. I got to ask Dr. Saylor a question. I'm seeing something about on these Lipitor. They're putting new warnings against memory loss and with diabetes, maybe?
Yep.
Is it worth stopping it?
I think the benefits of the medication outweighs the risks, and the diabetes question has not been finally answered. And the memory issues, I think, also a little difficult for all of us to understand this, but most people would say the benefits of the medications outweigh these risks. Yes.
Excellent. Now we're going to Ravi, who's waiting patiently. Hi, Ravi.
Hey, how you doing?
Good. Where are you calling us from?
I'm calling from Queens.
Queens, Ravi. Which part, Ravi?
Richmond Hill, Queens.
Richmond Hill. Very nice out there. What do you like to eat in Richmond Hill?
Excuse me?
Where do you like to eat when you go out there to eat?
Pretty much fast food, McDonald's, TGI Fridays.
McDonald's, TGI Friday.
I have a great mother. She cooks for me every day.
Oh, very good. That's great.
That's even better.
What can we do for you, Ravi?
I think I have an answer about one of those quizzes.
Oh, you think you have the answer to the quiz? Okay, we'll talk. Wait, I don't think there's another quiz.
Was answered already.
Yeah, everything was.
No,
not the first one.
Not the first one.
Oh, the first one was not
question.
answered. Sorry, thank you.
Yeah.
I stand corrected. Ravi.
Yeah.
What item is the most difficult to give up for Lent?
I think it's alcohol.
Any particular type?
Vodka.
Is alcohol vodka the answer? Oh, this will drive you to drink this quiz actually, but it's a tough quiz.
It's cool.
But you're not far away. You're getting in the right category.
Can I take another guess?
No. All right, Ravi. Be
a
well.
lot.
Good luck.
Thanks. Now we're going to go to Anthony. Hi, Anthony.
Hi, good evening. How are you? All right, how are you guys doing?
Now I hear you. Beautiful. Where are you calling us from? Which part of town?
Middle Village, Queens.
Middle Village. What's out there to eat? Dr. Gingrich, where do you go to eat in Middle Village?
Don't know the area very well.
What is out there?
London Lenny's I go to a lot.
Ah, London again.
all right.
Crowd pleaser.
Just ate there last night, actually.
It's fresh, right?
Always the best.
Yeah. And what about the place with the bocce? I love that place in Corona.
Oh.
The Parkside.
Parkside.
That is a great place. Have you ever been there, guys?
No, I've never have.
Yeah.
A summer's
Long
night.
time
There's nothing better. You go summer's night, you eat there, and then you go out and there's bocce games going on. You can play and make it interesting. You know what I mean? So.
And then you go to Corona, the Ice King.
I've got and then you go to Corona for some lemon Italian ices. Yeah, it's the best.
There you go.
Except for Spumoni Gardens, which is better, I think. But amazing. What can we do for you tonight?
Okay, I suffer from severe psoriasis.
Okay.
And my question is, does that have any effect on my blood pressure? Because I'm on Norvest 10 milligrams. It's always hovering around 140/90.
Let's see, Dr. Saki, could that have an effect on the blood pressure?
I'm not aware of a definite effect with psoriasis on hypertension, but certainly just being afflicted with psoriasis would certainly, the stress of all the medications and everything could certainly contribute to the blood pressure, but there's no direct correlation.
Is anything to do with the lungs and this type of disease?
You know, sometimes when you have psoriasis, you may have a connective tissue disease, and that can affect the lung. But directly, psoriasis shouldn't have any effect on the lungs.
Interesting. Okay, thanks a lot.
Thank you, guys.
Hope that helps you. Take care. Therese? Therese?
Yeah, hi.
Oh, how are you?
Okay, doctor.
Where are you calling us from, Therese?
I'm calling from Brooklyn.
Yeah, which part?
I'm calling from Bensonhurst.
Bensonhurst, a great area.
Yeah.
How long are you
I've been
living
here
there?
So long.
I know everybody lives there for a long time because they like it.
25 years, 50 years.
50 years. Don't you miss Jan's?
What's that?
Jan's, the ice cream parlor?
Oh, yeah, I remember Jan.
Remember that, Jan? You ever go in there and
Yeah.
get the kitchen sink? And
It was nice, yeah.
How many calories
in
in
it?
it?
It's so changed now. If you ever come around, you wouldn't even know it.
I hate when things
familiar
change.
with the area.
Yeah. I like it when things stay the same. And I think that Tommaso's there, though. What's the name of the place on 86th Street?
Oh, well.
Tommaso's? Tommaso's, where the guy sings the opera. It's very nice.
Oh, Tommaso's. Yeah.
Does a nice job.
Yeah, I think that's still there.
It is, yeah.
Yeah.
Anyway, what can we do for you?
I want to ask the doctor. I have diabetes. I'm 82 years old. And every night I go to sleep. I'm a very poor sleeper anyway, but that's besides the point. But during the night, I always wake up very hot and sweaty, and then after a while it passes, and then I go back to sleep. Is that from the diabetes? What is it from?
It could be. Do you check your blood sugar?
Yeah, I check it every day. I take insulin.
Okay. When you get sweaty like that, that can be a sign of low blood sugar. Do you ever wake up and check your sugar?
Only once when I was really felt sick from it, and it was low.
It was
at
low
that time.
Well, you might need an adjustment in your insulin dose, so you should speak with your doctor. Okay?
That would make you hot like that?
It may, particularly if you're sweaty.
Well, it's not always sweating like that. I'm just warm. I'm uncomfortable.
All right. Well, again, I would just check your blood sugar. If it's low, then you need an adjustment in your insulin. If it's normal, then it's something else.
Thanks for the call. We appreciate it.
But then, you mean it's not from the diabetes? I have to, the regular doctor, not the endocrinologist?
No, he's giving you the answer.
What I would I would suggest you check your sugar when you have these episodes. And if your sugar is low, then you should speak with the doctor who's prescribing the insulin so it can be adjusted.
Yeah, very good. So in other words, she's going to check her sugar, then see if there's a mismatch. Then she's going to go to her doctor.
I mean, I think that's always a good idea. A lot of people with diabetes have trouble with a lot of different symptoms, and I think the important thing is you have the availability to do the blood sugar, and then you'll know whether the sugar is high or low or
Excellent. Anyway, what we're going to do is we're going to take a short break. I know we've got a big crowd waiting, so we're going to come back. We're going to do what we call our rapid fire segment, where we're going to go around the room. Whatever the question is, you get. Whoever gets the question gets the question. It's a different, exciting part. A lot of people like that segment. So our topics are endocrinology, cardiology, lung disease, and internal medicine. Don't go away. We'll be right back for rapid fire.
Place your business on TV by becoming a sponsor to one of NET's family-friendly programs. See an increase in your revenue by reaching a potential audience of 4.3 million viewers in the tri-state area. We have a number of packages available, and we'll even produce your commercial. For information, contact us at the number on your screen and get ready to see yourself on NET.
And welcome back to Ask the Doctor, where our topics are endocrinology, cardiology, lung disease, and internal medicine. Now, this is the if you're keeping score at home, we're going to go to Rosa, who's waiting on a long time. Then we're going to go to a very important email. Then we're coming back to Tanya's to start the rapid fire. So I hope you got that at home. We're going to go first to Rosa. Hi, Rosa.
Hi, how are you, doctor?
Beautiful. How are you doing?
Okay, so far so good.
Where are you calling us from, Rosa?
Bensonhurst.
Bensonhurst, too. We get a lot of callers tonight.
Yes, you should go. But I know you like restaurants. You should go to La Sorrentina on 11th Avenue.
I love Sorrentina. I was there 2 weeks ago.
Oh, great.
Great place. Yeah, I saw they're having, again, you learn different things here. 2-hour meters are being installed in the restaurant. They were complaining it was only an hour. You couldn't eat, quietly. So as of next month, they're going to be 2-hour meters.
Oh, my goodness, wow.
Yeah, it's a big, I think it's good. I think it's a good idea. You have to run out in the middle of the meal checking your thing. So anyway, what can we do for you, Rosa?
Well, I've been taking for the last 2 weeks a product called Avalox for my bronchitis. I took it for 14 days, but I still have
I can't hear. Speak up, Rosa, because I can't quite hear.
Avalox for her bronchitis.
Oh, for bronchitis. Okay.
Yeah, I had bronchitis for 2 weeks, and I took Avalox, 400, I think it was 450 grams, the highest that you could get, and I took it 14 days, and everything was supposed to clear up, but I still have a cough. I don't know if this is just a cough or.
Okay, Rosa, just if I may ask, are you a smoker?
No, I don't smoke forget about it, for many years.
Good. So, Rosa, bronchitis is sort of a generic term. A lot of times when you have a cough, it can be called bronchitis. There's different types of bronchitis. Some people have what we call infectious bronchitis, where they have a cough and colored phlegm. Usually that gets better with antibiotic. It sounds like you had what we call a non-infectious bronchitis, which is where you had maybe some inflammation of your bronchial tubes. So if you're still coughing, my advice is see your physician. Maybe there's other medicine you require, maybe a chest x-ray. So if your cough is still troublesome, I would definitely go and see your doctor again.
I can hear the cough. Just coughing.
I appreciate it.
Feel better, Rosa.
Yeah, feel better, and thanks a lot for calling.
Thank you.
Take care. Tough one, right? You're seeing a lot of people with this
A
prolonged
lot of people
coughs?
have this cough, and usually it's an inflammatory cough, and we can get to the bottom of it frequently.
Very good. Okay, we have the email now, and it says it's from Lee. Dear doctor, one of my loved ones had a biopsy of his thyroid gland and is recommended to remove it. He would have to go on Synthroid, his medication, for the rest of his life. What does this mean to the rest of his body and quality of life? He already has COPD and high blood pressure. I look forward to your wisdom and possible referral as to what is known in New York City as the best in town. I'm hoping he's referring to the show. I don't know what he's referring to. But thanks again for any time and consideration you've given. So we have 3 questions that touch on all 3 doctors. Number 1, we have the thyroid nodule.
Right. When someone has a thyroid nodule or growth in the thyroid, the biopsy is the best test. It really gives us a great idea of which patients should have surgery and which patients we can watch. So if the biopsy is suspicious for cancer, the thyroid really should be removed. Synthroid or thyroid hormone is very safe. It's one of the safest medicines when administered appropriately. And I don't think you should be worried about your loved one taking Synthroid. And there are very few conditions that would make me worry about the use of Synthroid. It just has to be done appropriately and monitored with blood tests.
Thanks. Any word on the blood pressure or the COPD?
Blood pressure may be part of this, it may not be, but again, it just needs to be treated and controlled.
No real association with COPD and the thyroid nodule.
Excellent. Okay, so that concludes the regular portion of the show. We're now going to the rapid fire segment. So we're going to go to Tonya, and Dr. Saylor is going to take this question, which we don't know what it is, but let's see. Hi, Tonya.
Hi, it's Tanya from Clinton Hill, Brooklyn.
Oh, another Clinton Hill. How are you doing, Tanya? So Dr. Saylor is waiting for your question. What is it?
I want to ask Dr. Giedrich about my medication.
I lost control of the show here, so.
Go ahead.
Okay, what's the question?
Hi, I take 225 milligrams of Synthroid, and I go to a medical doctor. I want to know how often should I go see an endocrinologist?
When people are on thyroid medicine, actually your primary care doctor, as long as he's doing the tests, and can be sufficient. An endocrinologist often sees people when there are problems with management. And so I see people with thyroid problems on a stable dose of thyroid medicine maybe once to twice a year.
Hope that helps you, Tanya.
Yes, I used to see Dr. Giedrich years ago.
Oh, very nice.
Okay, bye-bye.
Nice to hear from you. We're now going to go to Sealy. Hi, is this Sealy's?
Yes, this is Celeste.
Celeste, and nice. I like it better than Sealy's. It's good. Celeste is a nice name. So what's your question for Dr. Saylor?
It's for the endocrinologist.
I can't.
My daughter,
it's okay.
It's a Giedrich convention.
It's fine. We'd love to answer questions.
What's the question, Celeste?
my daughter was diagnosed with Cushing's disease 2 years ago. She had pituitary brain surgery.
Yes.
And now they suspect there's an indication it might be coming back. What are the chances of that?
Actually, unfortunately, we'd like to believe for Cushing's disease that the pituitary surgery is curative, but sometimes it isn't. So she really needs to be checked carefully. There are some medications that actually can be used to block the production of the high cortisol levels, but she really needs to be reevaluated, I guess, okay?
She's being monitored. And Dr. Garner?
Yes.
My son worked with your wife, Ann Vincent,
Oh, is your son, what's his name?
Vincent in Turner.
Vinny, right. My wife speaks so highly of him and of you, and I wanted to give you a shout out today.
I know, he told me that.
Did you watch the beginning of the show?
Yes.
Oh, okay. I was going to say I gave it at the beginning. But no, I really wanted to send you a shout out. And my wife's, I think he left. Did he leave or
yes,
still?
he left. He's clerking for the Board of Ed, different departments.
A great guy from what I hear. And,
Thank you.
Thanks for reminding me, and I hope all goes well with you. And if you have any questions, we can help you after the show, okay?
I know. And did anyone answer the quiz?
No, we still. What is the number one, the most difficult thing to give up for Lent?
Can I give it a shot?
Give it a shot.
Beer.
Oh, it's a beverage. You're so close. Because we didn't do the shout out, I'll give you a second guess on that. What do you think?
Soda.
Look at the table.
Any hint? No, nothing? Looking at the table? No?
No.
But anyway, give my regards to him, please, to Vincent and to you.
I will.
Be well,
Thank
Celeste.
you.
Take care.
Bye.
We're going to go now to Sonia. It was actually an email, so we can't go to her. But Sonia's got an annoying problem, it looks like. She's got rashes under both arms that keep growing. She's had them for years. They don't go away. No one can help her. How do you get rid of these rashes?
Dr. Sacchi can answer this one.
Well, obviously it's a chronic problem, and whether she's had a biopsy or not, certainly seeing a dermatologist, I think, would be most important because they are experts in this field, and I would recommend her, if she hasn't already, seeing a dermatologist.
You wonder if she's irritating with shaving or with deodorants. Right. You wonder what's going on there.
It's certainly possible.
Anyway, hope that helps you. We're going to go to Rosemary. Hi, Rosemary.
Hi, doctor. How are you?
Oh, how are you doing?
Good.
What?
How about, should I try to answer the question?
Yeah, what's the most difficult thing to give up? The most difficult thing to give up for Lent. What do you say?
I said coffee.
Rosemary says coffee.
Oh, I can't be right.
Rosemary, I don't know. The studio is in amazement here.
Oh, I can't believe it.
How did you know? You just guessed it?
Well, I don't give it up.
But you know what it is?
I don't know why I knew, but...
It's amazing. Rosemary's one of our favorite callers.
I know, and I'm always winning.
She almost bought the shirt. Remember the $60 shirt?
Yeah.
Did you ever buy that shirt?
Don't even bring that up.
She almost bought it, right?
I know. I'm going to buy it, but I have to, I donated
Is
the
a donation.
money at the telethon.
Yeah, you can try and use the... Yeah.
Oh, my goodness. Look,
well,
I just want to ask a fast question.
Rapid fire. You're in the right place.
Metformin. Now, what exactly does it do? This drug.
Are you talking about the use in diabetes?
Yes, diabetes.
It helps your body use the insulin it produces more efficiently.
Oh, okay.
Okay, it's a very good drug.
It's not an appetite suppressant, is it?
Is it an appetite suppressant?
It generally doesn't suppress appetite, but it's a very good drug.
Okay,
excellent.
Good. Okay, thank you.
Great to hear from you, Rosemary.
All right, take care.
Take care.
Bye.
We now have Geraldine with us online, too. Geraldine, how are you? Geraldine? We'll give Geraldine a second. Dr. Saylor, give us some words of wisdom in pulmonary. What can people be doing as we head into spring and there are allergies, and what are we looking for?
So much of it is good common sense. Most important advice I can give anybody is don't smoke. Really a dreaded habit, and that's the best advice we can give. Don't smoke. And if you do smoke, stop. Exercise, good lung health, all of these are important, but the most dangerous thing to do is smoking.
I know you practice what you preach. You're out there in Prospect, right? I see you in Prospect Park running.
Yes.
So
Yes,
people
I've
should
seen
say
you
hello
too.
if they see you. Say hi, Dr. Saylor. Great runner. Really, I can't keep up with him. We got last caller of the night. It looks like it's Larry on line 3. Hi, Larry.
Oh, hello.
Is this from Chelsea, Larry?
Oh, yes. How did you know?
I don't know. I just know I memorize things that have no benefit. But anyway, how can we do? What can we do for you?
Oh, right. Yes. Hi, doctor. How are you doing?
Great.
I called actually over a month ago, and you told me to call back again.
Just
So,
refresh us. Refresh the audience with the question.
Okay, yeah. I'd like to tell you that, okay, I've been diagnosed with high cholesterol and high triglycerides.
Okay.
Okay, I've been able to bring my cholesterol down to 252 from 318.
Wow.
okay, through good eating and everything. But the trouble is my triglycerides, they're in the 700 range.
Let's get Dr. Saki, because you're close but no cigar here. Dr. Saki.
Well, that's a problem, and having a triglyceride level that high, it's unlikely that you'll get it into any controllable range with diet alone. I'm sure medications have been offered to you, and I think it was noble and a good thing to try to work with your diet. However, I think at that level, I think there is risk, and I think there should be this dialogue and discussion about medication to get it under control.
What the doctor said was to stop drinking red wine. How is that contributing to high triglycerides?
I don't think it's contributing much at all. I think this might be a genetic issue or the way your liver is handling the fats in your bloodstream. And I really think that medication, and in fact, take a little red wine, but take the medication, I think it might be efficacious.
Larry, on that note, we'll close. That's good news, right?
Oh, I'm sorry, say that again?
It's good news. Take a glass of red wine.
Oh, yes, I can drink the red wine.
Yeah.
Thank you very much.
Okay,
yes.
Have a good week. I'm sorry, Geraldine, we didn't get to you. The time just ran away from us. Call us back next week, 5 to 8. We're going to take you first. And that's it for this episode. I don't know where it went. It just flew away. I want to thank Dr. Edmund Gigerich, Dr. Terence Saki, and Dr. Anthony Saylor for coming in. And we hope we were able to help you. Now, it's good to remember to be proactive about your health. This means you speak to your doctors about your concerns, you go for second or even third opinions. You ask the pharmacist what you need to ask. Visit our website at netny.net/askthedoctor. Here you can read the weekly tablet column, you can watch past episodes, and you can check out important topics. And I want to thank you, Dr. Linda Lapatosa, for the Quizmaster doing double duty at this time of the year. And I want to thank you for all your questions. Also, tune in tonight at 10. We had a great show last week, and you're going to get to see an encore presentation of last week's show. So don't miss it. I want you to stay healthy, and I'll see you all on the tablet. Take care.